the hybrid model's hard. The workflows are really hard, and there's no benchmarks, at least not that I've seen lately, for this is the specific ratio of telehealth to in-person for this particular specialty, for this particular geography or demographic age range, right? And so it's really hard to figure out the balance because everyone's kind of figuring it out on their own, right?
Yeah, I think that's 100% right. Now, I have traditionally implemented hybrid because we were in big health systems or multi-specialty practice. And we were oftentimes, because we were using old rules of rural restrictions, we were partnered with rural locations. So it was a way to get rural patients a lot of times into specialty care at a distance. And so one rule of thumb I always give practices, if you are doing, when we're talking video visits and you have a hybrid model, is I actually don't say block out time unless you know you have the volume for it. Otherwise you lose time, right? You're like, I could lose time. So I always ask them this: does your practice run on time? It's okay if they don't, because it's very normal. And if they're like, no, not really, I'm like, okay, well, that's super normal. So what we suggest is putting your first few appointments of the day as telemedicine, as video visits, and your first few appointments after lunch. And that allows you to really, you're on time, right at the beginning of the day and right after lunch, because the reality is a patient sitting on a video for 30 seconds or 2 minutes waiting feels like 4 hours. So you've got to be on time. And so a little fix like that can make a big difference. And those same video slots, you can release them 24 or 48 hours in advance if they're not full to have an in-person. So it could be appointment number 1 is in person, appointment number 2 is video, appointment number 3 is video, and appointment number 4 is in person. But that's one way I always suggest as an easy way to make it a hybrid model right out of the gate, is just be open with yourself if you run on time. And if you don't, it's totally cool, but just stack those at a time that you're most likely to be on time.